Okay, really quick video about heart failure. So if you don't understand cardiac anatomy, you're going to have a very hard time with heart failure. So I drew a very rudimentary picture of the lungs and the heart and the arrows and how they kind of coincide together and work together. So deoxygenated blood comes from the body. So I have this arrow coming from the bottom and this arrow coming from the top because our head and our extremities bring deoxygenated blood back up to the right side of the heart. So the right side of the heart is blue to help visual learners remember deoxygenated blood comes into the right side of the heart. It travels into the right atrium, through the tricuspid into the right ventricle, and into the pulmonary artery that then the blood gets sent to the lungs to get oxygenated. So this whole side here is your venous side of your heart. This is your lower pressure side of the heart. So if you were to do a central venous pressure, you would be taking the pressure of the most centralized venous area of the heart, of the body, which is right here in the superior and inferior vena cava, like right here where it comes together at your right atrium. So that's a pressure reading, helping you see how much pressure is going on in this right side of the heart. We'll come back to that possibly. So the blood goes up to the lungs and gets oxygenated. Then it comes back via the pulmonary vein into the left atrium, through that mitral valve or the bicuspid, into the left ventricle, and out of the left ventricle through the aorta. So there's a little aortic valve there, and that gets sent to the body to be used. That's your arterial side. Arteries are a much higher pressure than veins, and it's oxygenated blood, so I made this side red to help with the visual learners out there. Hopefully that is nothing new. At this point in the game, that should not be new. But if you're having trouble, go back and rewatch this, go back and watch your lecture, go find some more YouTube videos, get in your textbook, pull from your A&P knowledge, and make sure that you understand blood comes from the body into the right side of the heart. It goes from the right side of the heart up to the lungs, from the lungs back to the left side of the heart, and then out to the body.